but still there are a lot of concerns regarding safety, especially when there is a lot of news articles saying that some person in Chennai developed some problem and he's going to sue Serum Institute and all of that. So what is your take on that, Dr. Vikram?
Yeah. With any intervention, obviously, there are a lot of effects and side effects. So, but with vaccines, especially with this vaccine, we have seen the side effects have been minor and they have been short lasting. Rarely, very rarely, there have been reports, not only with this vaccine, but even previous vaccines, of there being some adverse events, but these have been rare. To give you a heads up, people may die in a road accident. People may die, not only common people, but even politicians may die with road accidents. But this is a rare event. This is not a common event. 1 lakh people may cross the road, but that is not reported. One person dies of an accident, that becomes a big issue. So we have to see things in context. We have to compare the risk and the benefit. The benefit is huge. The risk is very, very minimal. And these are rare events. Majority of side effects, what have been reported, have been of the mild variety, like pain, like fatigue, fever in some patients. So I think you projected a slide, and you can see on the there are 2 columns here projecting the side effects. One on the light and the other is a darker blue. And if you can see that they are almost very, very similar. Now, if I Sharath can show. So the left one is the COVID vaccine related side effects, and the right is because of placebo. So the side effects are very, very comparable. And if I didn't show you what the name, you would think that's very, very similar, except for probably local pain, which is more in the vaccine associated side effects.
So what do you mean by, just sorry to intervene, Dr. Vikram. So, once when I was mentioning this to a patient, she asked me specifically, and she asked, what do you mean by placebo? So can you just answer that?
Yeah. So placebo is not the real medication. The simple terms, it may be in tablets, it may be just salt or sugar, or in case of infusions and injections, it could be just saline water. So it's not the actual medication. So in trials, they do compare patients with the particular medicine or a drug, and compared to patients who don't get the drug, but they should not know that they have not got the drug. So in those cases, we use something called as a placebo. So if you see, when the placebo has had certain adverse events, infusion of the placebo, injection of the placebo itself has also caused fatigue, headache, and chills, etc. So the side effects with the different vaccines, that is the Pfizer one and the modern one, also is very, very comparable. And if you look at the numbers here, 50%, 60%, these are side effects which have been very, very minimal side effects. They have not affected their quality of life. They have not affected their day-to-day activities. However, if you look at the side effects which are grade 3 or more, that means side effects which affected their day-to-day activities or quality of life, has been still less. It is in the order of 0.5 to 1.5%. So serious side effects affecting the quality of life or day-to-day activities, especially even the fatigue, headache, pain, affecting the day-to-day activities is very, very rare. So most patients had no problem or mild problems. So this is not only with this vaccine, it is with other vaccines also. An important point is, in the trial, not a single person has died due to the vaccine. Okay, so that is a very reassuring thing, that they had only mild to moderate side effects, and that too in no deaths being reported so far.